Disease-free survival, DFS, is a clinical endpoint in oncology that measures the length of time after cancer treatment during which a patient lives without any signs or symptoms of the original cancer they were treated for. It is a critical parameter in evaluating the efficacy of cancer treatments and assessing the long-term outcomes of patients. Calculation disease-free survival is typically calculated from the date of the initial diagnosis or the start of treatment, such as surgery, chemotherapy, radiation therapy, to the date when disease recurrence or progression is detected. If a patient experiences a relapse, disease recurrence, or the development of a new cancer, their disease-free survival period ends. Importance: disease-free survival is crucial because it reflects the effectiveness of the chosen treatment in controlling the disease and preventing its return. It provides insights into the potential curative effects of treatments and helps oncologists and researchers evaluate the long-term success of therapeutic interventions. Censoring disease-free survival calculations often deal with censored data. Censoring occurs when the study period ends before an event, disease recurrence, has occurred. Patients who are still alive and disease-free at the end of the study or are lost to follow-up contribute to censored data. These cases are censored because the exact time of disease recurrence is not known, and their disease-free survival time is considered as censored at the time of last follow-up. Survival curves: disease-free survival is often represented using Kaplan-Meier survival curves. These curves display the proportion of patients who remain disease-free over time. The curves start at 100%, all patients disease-free at the beginning, and gradually decrease as events, recurrences, occur. The shape of the curve provides insights into the pattern of disease recurrence over time. Clinical trials: disease-free survival is a common endpoint in clinical trials for cancer treatments. Trials may compare different treatment regimens to determine which one leads to longer disease-free periods. It's especially relevant for adjuvant treatments, which aim to prevent recurrence after primary treatment, e.g., surgery. Limitations: disease-free survival doesn't always equate to overall survival. Some recurrences might occur long after the DFS period ends. Disease-free survival might not account for the quality of life during disease-free periods. The threshold for what constitutes a recurrence can vary, affecting the consistency of DFS data across studies. Patients with shorter disease-free survival might receive more intensive monitoring, potentially detecting recurrences earlier. Relapse versus primary disease-free survival considers both disease recurrence, relapse, and the development of new primary cancers. Sometimes, it's important to distinguish between these two scenarios, as they might have different implications for treatment and prognosis. Caveats: long disease-free survival doesn't always mean cure, as some cancers can recur even after extended disease-free periods. Short disease-free survival doesn't mean treatment failure, as some aggressive cancers might still respond well to therapy. In summary, disease-free survival is a crucial metric in oncology that measures the time during which a patient remains disease-free after cancer treatment. It helps assess treatment success, guide clinical decisions, and understand the long-term outcomes of patients.